Hi, everybody. It's Lisa Selberg, live here at the HCMA office. It is 6 p.m. on March 26, 2019. And this morning on our private Facebook group, we had a little discussion about symptoms from HCM and sometimes how difficult it can be to determine whether our head or our heart is where the problem is originating. What do we mean by this? So there are two aspects here that are together but separate. Follow me on this one. So we know that people with HCM can have, just like everybody else, anxiety and depression, and those symptoms can sometimes be similar to those from hypertrophic cardiomyopathy. But we also know that sometimes our little bit of anxiety can feed adrenaline into our hearts, and then our hearts go kind of crazy, and because they're thick and they beat hard, it feels really scary. So then we drop more adrenaline because we're scared. And it's this vicious cycle of the cat chasing its tail. And which is really in charge? Is it the head or the heart? I told everybody in the private group a story this morning about my father. My dad passed away in 2008 from HCM, but he wasn't diagnosed until he was 59 years old. He passed away at 73. But when he was a child, everybody told him he was just anxious. He was just an anxious boy, and that he needed to calm down. When he became a young man, he was an anxious young man. When he became 30 years old, they put him on anti-anxiety medication. And then when they finally treated his heart properly, his anxiety magically went away. So sometimes it's difficult to tell the difference between anxiety and HCM. So I was asked by a number of people if they could share my message from this morning, but it's a private group and you can't share anything from there. So I told them I'd come here and I would share this because a number of people wanted to share this with their family members, because it's a complicated equation. We have hearts that are too thick, too stiff, don't beat right, can be subject to arrhythmias, we can be in and out of heart failure, and we look pretty normal on the outside, so it's hard to tell what's going on the inside. So it's really difficult for us sometimes to know if we're dealing with a mental health issue, if we're dealing with a cardiac issue, or if the two of them are playing against each other or with each other in a way that's a little difficult for us to understand. So what I had said this morning, and I will say it again for the rest of you who are watching now, when you have hypertrophic cardiomyopathy and you're not sure if the symptoms are coming from here or from here, your heart or your head, I would encourage you to have a very long conversation with your HCM care specialty team and make sure that you're really parsing out what is a physical reaction of your heart and your physical symptoms and what is emotional. We have a lot of anxiety in the HCM community, and for good reason. We're living with a genetic disease that can have very serious consequences, not only on our lives, but the lives of those we love. So yes, it is acceptable to understand that we have a higher level of anxiety than maybe some other people. There are other diseases that have their own set of problems. These are ours. We're not trying to discount anybody else's connection between chronic illness and anxiety. It's common in our world of chronic illness. So we want to make sure that people understand that sometimes it's hard to tell the difference whether or not our head is starting the problem or our heart is starting the problem. And there's only about 12 inches between the two, so it could get a little confusing from time to time. So we are encouraging every one of our members, if they aren't quite sure what's going on, to have that really tough conversation with your healthcare providers. I would recommend you start with your HCM care provider because they're more likely to understand the cardiac implications as well as the mental health implications. And here's the other thing that I have to say, and I'm not going to use names here, but within the HCM community, we have had more than our fair share of cases of self-harm and suicide. And I can't speak to the underlying etiology there in terms of what was the driver in their choice, but I know that it's happened, and it's happened to people that I care very dearly about, and they were my friends. And we need to make sure that if you are in that situation where you are just feeling like you're at the end of your ropes, that you reach out for help, because we can make your heart feel better if we know what's going on, and we can get the teams involved in your care to help your heart feel better, and we can get teams involved in your care to make your head feel better. And if we have two teams working together to make your physical health better and your mental health better, then we have a real shot at making an improvement in your life. So I did say on the topic here that let's discuss, and I have a couple comments here, and I'm going to bring this one up. Renee, before she was at Mayo, it was recommended to go to a psychiatrist many times, and it was frustrating. So this happens quite frequently when somebody doesn't know what's going on or they don't understand HCM. So if you're not at an HCMA recognized center of excellence or a very high quality HCM care team, wherever you are in the world, I would encourage you to find one, because they're going to understand that connection a little bit better than a general cardiologist. All due respect to the general cardiologists of the world, we love you, but you don't understand us so well sometimes. So Kaylee, what do you have to say here? Let's see. I'm very lucky that my gynecologist's husband has HCM and she understands my triggers and my heart. Currently on antidepressant and doing well for now. I need to keep my anxiety in check. And you're welcome for the help. So these are really common issues. If you have any other issues or comments on this, please share them here. I kind of wanted to just have a quick discussion about it. I don't have forever to sit here today. I got to get off to another meeting. But I did want to bring this up today in a format that could be shared with your family and your friends so they can understand us a little bit better. This is a complex disease we have. It alters the structure of our heart, the rhythm of our heart. It can cause sudden cardiac arrest. It can cause congestive heart failure and heart failure, diastolic heart failure. It's scary. So it's really important that we not only take care of our hearts, but we take care of the rest of ourselves, that we be kind to ourselves, that we let ourselves relax, and that we don't constantly feel like we have to keep running to try to keep up with people that our hearts are probably not going to let us catch up to. Okay? We have to accept our limitations. We have to work our best to balance our physical life and our mental health life. And I think we have a great community that's here to support each other, but I don't want it to get lost that there's not a connection. There is. And as you have different episodes come up in your life, that stress and anxiety may pop up and then it may go back down again. If you're fine for a couple of weeks, months, or even a year or two, and the HCM isn't bothering you, and you think, I'm good, and then all of a sudden you have a run of an SVT, or you almost pass out, or you can't catch your breath while walking to a bus and you have to stop and everybody's asking you why, this can provoke anxiety. And a note to family members, sometimes the more you ask us, how you doing, how you feeling, how you doing, how you feeling, you're actually provoking anxiety sometimes. So I have discussions about when is appropriate to talk about this and when they shouldn't be harping on you, because sometimes that does bring anxiety. In my home, before my transplant, I had a daughter with HCM and a niece with HCM in the house, and we kind of fed off of each other sometimes. If somebody was having a symptom, the other ones would be like, oh boy, what's going on here? So you have this whole family dynamic going on. So now I can tell the story because number one, I don't have HCM anymore. And number two, my daughter's now 23 and my niece is from something. So they're all grown up. But my husband and I had hand signals. If I was having chest pain, I would call his name and I would make a signal when nobody else was looking, and he would give me about 10 minutes, 15 minutes to go relax. And that way I didn't invoke anxiety in them, and they didn't have to know anything was going on, and everybody just went about their day. If I was really in trouble and I felt very dizzy or I thought I was going to pass out, there was another signal for that. And I would go take care of myself, or he would keep an eye on me during those events. So sometimes you have to come up with ways of communicating and ways of talking. Amy, what do you have to say? Amy says, thank you for shedding light on this. I have a 17-year-old with HCM. Yeah, so for those who follow the private group, and I have permission to discuss this from my daughter, I wouldn't do it otherwise. My daughter probably gets it from mom. It's also genetic. She's a bit of a workaholic. I say at 6:15 while still sitting at my desk. She's a bit of a workaholic, and she's going to school for her master's. She wants to be a counselor. She's working as a behavioral health counselor in a mental health institution full-time, 40 hours a week plus, doing a lot of overtime. And she's working on a little side gig with a friend to have a barn, and she has a couple horses up there, and they're starting to do, she's going for a certificate in equine psychotherapy. So she's a little bit of a workaholic. And she hit the wall. She was sick a couple weeks ago, let herself get a little dehydrated, got a little tacky, ended up in the doctor's office at her cardiologist the other day, and she's kind of on a 3-day, 4-day rest period because she pushed it too hard. Now, how do you have that conversation and say you're pushing it too hard to the person that you love without annoying them? Well, I was trying to tell her she was pushing it, and she had to kind of fall off herself and see that she was really pushing it. Now I think she's going to listen a little bit more. And it's a balancing act. Don't harp on people, but care. Don't push the envelope. Talk to them. Find out something that works so that your questions are not invoking more anxiety. They're calming the anxiety. Create that comfortable place to have a conversation. Brant, my dear, how are you? You are welcome. Good to see you. Hope you get to my side of the game pretty soon. And if you have any questions, do call me. We can talk about it. So I put this out here today, just a quick video. I'm not going to go much longer, just to explain that anxiety is real, but it's also fed by your heart to a certain degree. So please talk to your cardiologist, your HCM specialist about best practices to deal with your heart, your anxiety. And if need be, please, there is no stigma in taking care of your mental health as well as your physical health. You're one person. You can't separate these things. Take the time for you. If you need talk therapy, go to a therapist. Talk it out. If you need psychiatric medication because there's something going on with a chemical imbalance or it's out of whack, please use them and get the care that you need. And my husband's calling me now, and I'm going to hang up on him. Sorry about that. But just an impromptu little chat with you all here today, and hoping that you take your physical and mental health very seriously, and know that if you need to create a plan or you're not sure where to find resources, do contact the Hypertrophic Cardiomyopathy Association, and we will do our very best to align you with quality HCM care, which most of them now have a very strong mental health component. And for those programs that don't yet have a strong mental health component, we're trying to build those out for you. Have a great day. I hope you all have a good physical and mental health day today and tomorrow. And oh, one more question. Much needed right now. About to book your SICD surgery. You're very welcome. Good luck with your SICD, and I hope it goes well for you. If you have any questions, want to talk about what it's like to live with a defibrillator, either go to the private group and discuss it with your peers or call the office and discuss it with us. Okay, guys, have a great day. Bye-bye.